Started.
My name is Brianna Parks, and I'll be giving my informative speech today over schizophrenia. This is my audience for my speech. This is my outline. And these are the flashcards I will be using. Okay. According to the National Alliance on Mental Illnesses, about 1% of Americans have schizophrenia. I'm here today to talk about what schizophrenia is, some biological causes of it, how to diagnose it, and symptoms, and then finally we'll talk about treatment and the effectiveness of treatment. Talking about schizophrenia is very important because there's a lot of misconceptions around what schizophrenia is and what it actually looks like. So we'll start. The word schizophrenia literally means to have a split mind, but people who suffer from schizophrenia don't have multiple personalities or even a split personality. The Mayo Clinic defines schizophrenia as a severe mental disorder in which a patient's reality is severely abnormal. There are 4 different biological causes that could relate back to schizophrenia. One being genes, which would be, according to my Metropolitan Community College Fundamental of Abnormal Psychology book, states that some people are just more prone to having a biological predisposition to having schizophrenia. Another cause could even be biochemical abnormalities, which mainly consist of the dopamine hypothesis, which is just where the neurons seem to fire too fast and too often, which could cause some of the symptoms of schizophrenia. Another cause could be brain abnormalities. This could consist of the ventricles being too big and enlarged, which could indicate that the surrounding areas of the ventricles could not have developed properly. Some other abnormalities that have been noticed in people with schizophrenia are abnormalities in the hippocampus, the thalamus, and the amygdala. But just because there's abnormalities in any of these areas does not mean that someone has schizophrenia. Another cause of schizophrenia could even be the viral effect, which is when a woman is pregnant and she is exposed to a very certain type of influenza. There could be a virus in that strand of influenza that could go into the baby's brain and stay dormant until later on. Schizophrenia doesn't usually present itself until early teenage years to adulthood. So how do you diagnose schizophrenia? Many schizophrenics have to go through a physical exam, a screening and testing, and then a psychiatric exam to try and eliminate any other causes such as a brain tumor, using of drugs and alcohol, or another disorder such as dissociative identity disorder. Once they have gone through this, they also need to make sure that the patient has also suffered from at least 2 symptoms for a minimum of a month. So what are the symptoms of schizophrenia? There are 3 different types of symptoms: positive, negative, and psychomotor. So let's talk about positive symptoms. This positive symptoms means it adds to the characteristic. So this would consist of disordered thinking, which usually means the brain moves too fast, and someone could be talking about a joint custody case, and then because they heard the word joint, automatically start to think about the joints in your body. Heightened perception, so that would be like when someone with schizophrenia could see the grass outside and then feel overwhelmed and flooded by how bright it is to them. Hallucination, which affects all 5 senses: auditory, visual, olfactory, and tactile, and somatic. And then there's delusions. Now, there are 3 different types of delusion. There's the one that most people automatically think of when they hear the word schizophrenic, and that is delusion of control, where they believe they are being controlled by someone else or something else. There is gradual delusion, which is where they believe they are a superior human being or even a religious figure, so they could believe that they are God. And then there is delusion of reference, which would be where they believe they take in signs and believe that they have personal meaning. So it would be like seeing the sky is blue and then believing that that means you have to eat blue food all day. And then there is also inappropriate affect, which is another positive symptom. Now, on to negative symptoms. This is usually characteristics that are taken away from someone suffering from schizophrenia. This usually is poverty of speech, restricted affect, which is where you have little to no emotion, loss of volutation, which is a lack of empathy, and social withdrawal. Now, on to the last one. There is psychomotor symptoms, which is awkward movement, repeated grimace, or even really odd gestures. The World Health Organization says schizophrenics are 2 times more likely to die earlier than the general population. So how is schizophrenia treated? There are 3 different main types to treat schizophrenia. There is therapy, which usually breaks down into individual therapy, which consists of psychoanalysis, and cognitive behavior therapy, which is where they go to a therapist and they learn more about their disorder and how to cope with it. And then there is family therapy, which is more for the family to understand schizophrenia, how to cope with it, and to support the family. Therapy is very beneficial for many schizophrenics, especially when used with other types of treatment, such as drug therapy. Antipsychotics have been around since the 1940s, which is the main type of drug therapy for schizophrenics. There is first generation antipsychotics, which developed in the 1960s through the 1980s, and they're also known as conventional antipsychotics. And then there are second generation antipsychotics, which developed in the later decades. Now, the main difference between the conventional and the second generation antipsychotics is that the conventional antipsychotics, doctors started to notice that there was an uncontrollable and side effect, which was like tremoring of the lips and hands. And so they've moved more towards the second generation antipsychotics. Second, according to my Metro Community College textbook, Fundamentals of Abnormality Psychology, antipsychotics can reduce symptoms by 65% and can even reduce symptoms even more when combined with other types of treatments such as therapy. Now, the final type of treatment we're going to talk about today is ECT, or electric convulsive therapy. This is only used when drug therapy has failed. This requires a general anesthesia and a drug to help relax the muscles. And then the patient is taken back to a doctor where they hook up electrodes to the head that send a electric current to the brain, causing a little brain seizure. This is done 2 to 3 times a week for 2 to 4 weeks. ECT has been known to be very effective, but the drawback being that it is also very, very expensive. Today we have covered some of the critical areas to have a better perspective on schizophrenia and understanding what it is, some biological causes for it, how to diagnose it, some of the symptoms, and treatment and how effective some treatments can be. There's so much more to schizophrenia than what most people think, hearing voices and talking to yourself. And in today's society, it is crucial to take the time to understand what mental illnesses are and how they affect people. Thank you. And my audience is still here.